All right, everyone, this is part 2 of our special guest, Dr. Jim Oschman, coming from Dover, New Hampshire. All right, take it away.
Okay, well, I gave you kind of an overview of what can happen from connecting to the earth. It's free if you want to go outside. It's not, this weather in New Hampshire right now is not conducive to walking around barefoot or sleeping on the ground. But fortunately, there are these simple, inexpensive technologies for bringing the earth into your home or office. Even if you're in a high rise, most modern homes and buildings have good grounding systems. And the third prong on the electrical outlet should be a good ground. And you can connect yourself to the earth. And you can use these, put the patch on a place that hurts. Simple to put a sleep system on your bed and forget it. No refills. It just, you've changed your life. Your health will improve if you have, and it's amazing. For example, there are people who have a condition that the doctors can't figure out what to do about. Those are the people who need to get grounded. It looks like they probably have an inflammation somewhere in their body. Nobody knows where it is. Nobody knows how to find it. But electrons from the earth will be attracted to these positively charged areas in the body, and the electrons will neutralize free radicals that cause pain and inflammation and chronic diseases of all kinds. So it's that simple. It's really very simple. And my goal is to get this out to the world. Thank you, Suzanne, for helping me to do this. We're going to have a film. There's already a film that's available from the web. The products are available from earthing.com. All of the research is at theearthinginstitute.net. We have more than 20 papers. I've written a bunch of them. It's been a great thrill to work on such a project that can benefit so many people. And I plan to, when the film comes out, travel around the world, show the film, answer questions. And I'd be happy to answer any questions.
I have a question, so I'm just going to jump right in if that's okay.
Good.
I am loving my grounding mat and have had my own personal experiences right from the get-go and for the last 5 days. And I have loaned one out to someone. And I guess the question is, some people feel it right away, some people don't. Why? And if somebody doesn't feel anything, I noticed in your commentary, you know, it took like 3 weeks or 5 weeks for some people to get benefits. And I just feel everybody's in a different place, so it's going to take a different time. And I would just love your professional perspective on, even if they don't feel anything, I feel that something's still happening and it just needs more time. So can you just respond to that?
Well, people are different. And young people who are pretty healthy don't notice much. Maybe you need to go out and fall down. Try it out. I don't recommend that. No. But people are different. Some people have a reaction, which is a detox. And they start to feel bad from grounding because their cells are detoxing. And what they need to do is, like anything else, try it a little bit at a time. Try 5 minutes, then go to 10 minutes, and gradually build up to it like you would build up to any treatment that affects your body. So that's my suggestion. People are very different. If the older you are, the more likely you have aches and pains, and the more amazed you will be. And often many things clear up at the same time. Insomnia, arthritis, skin problems, all go away. That's pretty cool when that happens.
Do you think that if someone has a, like Parkinson's or MS or something more chronic, it takes longer than if someone has something that's, I mean, not to put a number on it, but less severe, or again, it's unknown?
Yeah, it can take a while. All these conditions are different. I can tell you that for Parkinson's, all of these, it's good to find other things that will go along with the earthing.
Yes.
I'm a strong believer in essential oils.
Mm-hmm.
Aromatherapy can be amazing and very beneficial, and you can combine it with earthing.
Mm-hmm.
For Parkinson's, stretching is very good. Mm-hmm. Anyone with Parkinson's needs to check out stretchingusa.com. A fellow who has developed a stretching protocol that is hugely beneficial for Parkinson's. The drugs for Parkinson's are not very pleasant.
Right. So I like that things that can complement one another in a variety of ways. It's not just one thing, but good, healthy water, nutrition, exercise, etc. So thank you very much.
Sure. I actually, alternative medicine is my specialty.
Mm-hmm.
I'm probably one of the first academics to really dive in to alternative medicine. I've been doing it for a long time. And when I started, it was something that everyone knew I had lost my mind. It was frowned upon for an academic scientist to look at alternative medicine techniques. Mm-hmm. And that didn't bother me. I was told that there's no scientific basis for alternative medicine, and I found out there is. There's plenty of science, and that's why I wrote the books.
Thank you, Dr. Oschman. I have a question. Is there any harm in leaving a grounding mat or sheets or pads plugged in all the time to the grounding outlet?
No, there's no harm.
Okay.
There is one contraindication. If you're taking a blood thinner, you have to be a little careful because earthing thins the blood. So if you're taking Coumadin, you have to talk to your doctor, and you may have to reduce your use of Coumadin or any other blood thinner. You don't want it to get too thin.
Would that also apply to people taking medication for diabetes, like metformin or something else?
Yes, it does apply because the people with diabetes are finding that their blood glucose drops amazingly when they get grounded.
And my other question is, in your A to Z list, which would be wonderful if we could have access to that maybe through one of your books or someplace else, does it have to be placed on or close to the source of the issue? Like, for instance, some people, it was mentioned about hair growth. Do you have to put it near your head, or will it work if you also are using it as on your feet? What's the experience you've had with that?
You can put it anywhere. The skin is conductive. The body is conductive. Kidney 1 on the bottom of the foot is a great point. The palm of the hand there's a similar point in the palm of the hand that connects to the whole meridian system. You can put the patch next to a place that hurts. That's probably a good idea, although the body is conductive and the electrons will reach anywhere they're needed.
Thank you.
Sure.
Doctor, can you say a little bit about Wi-Fi and EMFs and that, go into that a little bit further?
Yeah, this is a very serious problem. And people are not aware of it. They love their cell phones. I love my cell phone. And we need to know about this. People need to know that they need to restrict their use of cell phones, get a technology that enables you to talk on the cell phone without holding it up to your head. There are various protective devices. I have one on the back of my phone. This comes from Spain, and unfortunately, you don't seem to be able to get them in the United States. But there are some technologies that are very valuable. And grounding your body really prevents these fields from affecting you as much as they might. There's an epidemic of electromagnetic sensitivity. Some people are so sensitive they can't go to the mall. If they go to the mall, they get sick. Some of these people are so sensitive that they're moving to Greenbrier County in West Virginia, where they have the radio observatory, and the government has shut down all Wi-Fi, TV, radio, because it would interfere with the radio telescope. So there's a community of people there who have escaped from the electromagnetic noise that all of us are living in. There's a move on to go to G5 or something 5, stronger, putting
5G.
5G, thank you. That is a catastrophe and is to be avoided. They're putting smart meters on your electrical system. Those are also a disaster. And if you have a chance, opt out. Tell the electric company you don't want a smart meter. And I think in Massachusetts, they decided not to use them. And there are things you can do that prevent the smart meter from radiating into your home. You can put a shield on that part of your house to keep the radiation. Let it go out to the electric company. You don't need to irradiate you with their smart meters. It's a big problem.
Barb Satterwhite, you had a question?
I did, and Anne addressed it. Dr. Oschman, you know, there seems to be an epidemic of AFib these days, and my question being, obviously, Coumadin would be a big deal, but with the other drugs, is there really a way that they can even determine a difference in blood viscosity or excess bleeding? And I guess my question is that I can guarantee you a majority of my friends have AFib, and I want them all to be grounded. So I was curious as to your take on really the other drugs and how you would even assess that.
The way you do it is to measure blood viscosity, and it's called the zeta potential. It's the potential on the red cells. And the method we used was the one I described, where you take a blood sample and put it between 2 electrodes on a microscope slide and pass a current through the blood and see how fast the cells migrate. And that tells you how much charge there is on the cells. So that earthing reduces blood viscosity, which is related to all of the cardiovascular issues. Left ventricular hypertrophy, AFib, peripheral artery disease, high blood pressure, all of them. And we wrote a paper about this. Go to the earthinginstitute.net website and you will find are papers, including the one on measuring the zeta potential. There's also a method that doctors use to measure your clotting. I've forgotten what it's called, but I know it exists, and cardiologists will check your clotting properties.
Like the pro time, probably.
I don't remember the name of it.
Is that a SED rate?
No,
PT and
thrombin time.
PPT.
Thrombin time. Barbara's correct on the clotting.
SED rate? I think that's it.
Pro time, prothrombin time.
Or thrombin clotting time.
Yeah.
PPTP?
So I guess I'm asking in general then, somebody that's on any of the non-Coumadin blood thinners, you would suggest they get the testing. The only concern I would have is I don't know of any physicians that do the Zeta testing.
No, they do the SED rate.
Or the pro time.
It's,
Is
Yeah,
there a special lab for those Zeta testing? Can any laboratory?
Oh, it's not very common. There is a fellow I met who has developed a very good test that uses a very fine capillary and it measures the blood flow through a very finely drawn out glass tube. That should be a standard measure. When you go to the hospital emergency room and they take your blood pressure, your blood oxygen, and on and do a bunch of standard tests, your blood viscosity should be one of those tests, but it isn't. Someday. There are a bunch of tests that need to be added to the standard protocol.
I have a question. And looking at the video, it looks more like the speed of circulation rather than the clotting factor, like platelets that stick to one another. Do you know if there's a differentiation there?
One of the things is that there's less clumping. So the two pictures look different because with grounding there's less clumping. So it looks like there are fewer cells on the left side before earthing. And the reason it looks like there are fewer cells is because there's so much clumping. And clumped blood does not carry oxygen very well at all.
And it also blocks up small arteries. So that's where you get all your complications with cardiovascular disease.
We did have a problem during when you shared screen. We didn't get to see the video, but I will send that out to everyone in conjunction with these recordings.
great.
Lori Jones, you have a question?
I do. Dr. Oschman, I'm curious. I went and gave blood not so long ago, and it took them 3 minutes to get a whole thing. I mean, my blood was just, she said she's never seen anyone give blood so fast, ever. And this lady was, she was with the Red Cross for over 20 years. And I drink the PIMAG water, and of course I ground because I'm in South Carolina. It's beautiful down here. I've been grounding just about every day. Does it have to do with all of that? She said she's never seen anybody's blood come, just bam, it was done, over and done so fast.
Well, your blood is very healthy, I think. That's a good sign. People who have cardiovascular issues, their blood can be like ketchup. The heart has to work harder to pump it around because it's so thick. So you're in good shape, is my estimation. My diagnosis is you're in good shape.
And does that have to do with the viscosity of it, how it's flowing and all of that?
Exactly.
Okay. Thank you.
Good for you.
And doctor, I noticed on some of the product pictures you had like a chair pad, that type thing. So is it
that the people can be dressed and still be on the
Yes.
products
Yeah.
and have the effect?
Yes. When you have part of your body against a chair, there's a little bit of perspiration that forms. And that enables your clothing to become conductive.
Ah, okay. Thank you.
Women don't perspire. Women glow. Horses sweat, men perspire, and women glow.
Yes, we do. And another glowing person, Carol Hackpart, has a question for you.
Okay.
Go ahead, Carol.
She's muted.
Where are you, Carol?
Can you hear me now?
Yes.
Okay. Yes, thank you, Dr. Oschman. This is really wonderful. I have a question because I have a friend who has recently had a stroke, and he came through and he's fine. I mean, but they're recommending cholesterol Lipitor because they said that that will help prevent the flaking off of cholesterol buildup in the wall of the artery. And I'm just wondering if grounding would do the same, or if that's even a thing. They don't know whether there's buildup. They don't really know why he has the stroke.
Well, I'm not a physician and I can't make a diagnosis, and I am not allowed to recommend a treatment. So none of these things that I talk about are recommended treatments. I do this to give you information on what you might choose if you want to. There's a lot of confusion about cholesterol.
Yes.
Huge amount of confusion.
Yes.
And Dr. Sinatra, who's
Yes.
the first, he's the cardiologist who has worked with us, has written extensively about how much nonsense is connected with cholesterol.
Yeah.
When they change the level of cholesterol, that means you need to take a drug. Every time they change that amount by a few points, they sell another $1 billion worth of cholesterol medicine. There's a vested interest there.
Yes. Would grounding though, like with when it reduces the clumping and it increases the oxygen availability in the blood, it seems like that would be a good thing. Or
Yeah, that's a good thing. And all of the systems in the body are electrical.
yes.
So when you ground the body, everything normalizes. Everything works better. All the biochemical systems, nervous system, circulatory system, everything works better.
Okay. And a related question is, did you say in your presentation that people that have suffered from migraine headaches have benefited by the grounding?
Yes, people have great success with migraines, with
Okay.
ground. Not, well, the testimonial that I have, that I put in my list, the woman says that when she gets an aura, meaning that she's about to have a migraine, she
Right.
grounds herself right away. And that helps a lot. It stops it in its tracks or slows it way down.
Wow.
So
Thank you.
that's good to know.
It's very good to know. Thank you so much.
Dr. Oschman, if you have your grounding mat plugged in, say at work, or you sleep with it, is it best to unplug it from the ground in the wall, or can it be left in 24/7?
Oh, you can leave it in. It doesn't draw any electricity. It won't raise your electric bill.
It won't harm the product at all.
No, no.
Okay, thank you.
Doctor, other than the blood thinners, are there other contraindications other than blood thinners?
I think that's the main one.
Okay, that would make sense.
It's can't hurt you.
Thank you.
That's the only thing that I know of that you have to watch out for.
Because we do live on the earth, right?
We do. We just never touch it.
Less and less. Well,
Fortunately, when you take a shower, you're getting electrons from the earth. The water comes through metal pipes in the ground. And this is why when you're feeling funky and you take a shower, you feel more alive afterwards. You're restoring your electron system in your body. Right?
that sounds fabulous. Well, I realize that we're after 9 o'clock. We've certainly taken up a lot of time, gotten a lot of great information. I want to thank you for this session. I know everyone is thrilled with this opportunity. And again, you know, there's no, we're not making any claims. These are experiences that have been shared. And we just thank you for your time, and everyone had such great questions. So